The Ghana Health Service has confirmed 2 new Mpox cases, a total of 4 in Ghana now. Is that a cause for alarm? Or is everything under control? Let's connect now with Dr. Joseph Oliver Komi. He's the director, Ghana Infectious Diseases Center, Mpox Case Management Lead. Hello, Doc. Good morning. Hope you're well.
Yes, I'm fine. Good morning, and good morning to your listeners.
Thank you so much for making the time to speak with us. And today our focus is on Mpox. We want to know whether we should be alarmed or if this is something that is firmly under control. So let's get stuck straight into it. What are the main signs and symptoms of Mpox? How do they differ from common illnesses like the ones we know, chickenpox or even smallpox?
Okay, so the key thing is that Mpox is a viral disease. The virus that causes Mpox, the monkeypox, comes from the same family as smallpox and chickenpox. Smallpox has been eradicated. Chickenpox is still around. The rashes are quite similar, but then there are subtle differences that come with a trained eye. The key thing is that for chickenpox, hardly will you get swollen lymph nodes, or we call them glands, swollen glands. But with Mpox, you will get swollen glands. The distribution of the rash is also very important. Chickenpox mainly starts on your trunk or your limb. Mpox usually will start on your face and will involve the whole body, involving mainly also your genital area, including your palms and your soles. So Mpox is more or less, let's say, chickenpox upgraded, if I should put it that way.
Now, are there differences in how Mpox presents in children, in adults, pregnant women, and also persons who might be immunocompromised?
Well, I must say that I'm sure you've heard us say most of our cases are mild. Most of our cases are mild.
That's right.
Almost all the cases we have received so far are within the age range of about 25 to close to just about 40 or so. Mpox presentation in that age group is mild. However, Mpox presentation in children less than 15 years may be quite severe. In elderly also may present with severe symptoms. And then people who are immunosuppressed, which means we shall add the pregnant women in this case, and people with HIV, diabetes, undergoing cancer chemotherapy. So just like what you said, all these people may have a severe presentation of Mpox. In that case, they may have Mpox lesions in their mouth. In that case, they may have what we call superimposed bacterial infections. Some of them may have Mpox affecting their eye, maybe which may lead to, let's say, blind and becoming blind later in life. So in that age group, on these specific groups, Mpox presentation will be severe.
Thank you for that insight. So at least we know that for the cases that have come to your attention, they're within the 25 to 40 age bracket and are presenting in a mild fashion. Of course, could be different if the age bracket was lower or significantly higher, as you mentioned, with the elderly. Now, how is Mpox transmitted from person to person, and are there certain behaviors or situations that can increase the risk of infection?
Okay, so first, unlike other diseases like COVID, where asymptomatic people could transmit the infection, with Mpox, you must have an infected person showing the lesions, the typical pox lesions. And then when you come into contact with the fluid from these lesions, then you will also develop Mpox. So it must be contact. We call Mpox a contact disease. How do we get into contact? So maybe the person with the lesions or the sores or the Mpox rash on their skin, it's not covered. And then maybe you sit in the trotro with that person. And in church, sometimes we sit close together.
That's right.
For long contact, you are at risk of developing Mpox if that person is infected. When we have, the other thing is about sexual contact. You cannot have sex and stay apart. So sex is a intimate contact. So if I have Mpox lesions around my genitals and I have unprotected sex with somebody else, that person also stands the risk of contracting Mpox. Somebody asked about kissing with Mpox. If I have Mpox lesions in my mouth and I'm going to kiss them, that's also prolonged contact. And so the key issue here is that there must be contact with somebody who has Mpox and has the lesion. And then when you get to contact with the fluid there, you will also develop Mpox.
Do you have to have lesions yourself? Let's say you're not the person who has the Mpox, but you sit close to somebody in a trotro and they have the rashes maybe on their arms. Is it just the contact skin to skin that can expose you to the Mpox, or do you have to ingest it? Does it have to go in the bloodstream like we know for maybe some STIs and so on and so forth?
So just like, chickenpox. If you've experienced chickenpox before, you just have to have contact with the person with chickenpox or be in a close environment with the person, and you come into contact with that person, you will also probably come up with chickenpox. That's why we keep on saying that if you have a rash, cover your rash. That's the first thing. So wear protective clothing that will cover your rash. Let's say you have a rash and you want to go to the hospital to seek health care. You do not have money to take Uber or anything, and you're going to sit in the trotro, then make sure that you're wearing maybe long sleeve shirts, you're wearing trousers, or something to cover your rash so that you reduce the risk of exposure to other people who might not know.
Certainly. Now, we talked about persons who might be immunosuppressed, maybe have some pre-existing medical conditions, the very elderly, and also children who could stand the risk of getting it quite severely. That's Mpox. But are there any other particular groups or communities currently at a higher risk for Mpox infection?
I guess where the discussion is going. But I know over time, people have been asking whether Mpox is a sexually transmitted infection. Like I said earlier on, you cannot have sex when you are 2 meters apart. So then if I have Mpox around my genitals and I have sexual encounters, then we will say that having unprotected sex with somebody who has Mpox is a great risk factor. I'm sure you've read over the period that amongst the key population, we tend to have an increased risk of Mpox in that community. So yes, if you are engaging in, let's say, commercial sexual activity, and then you may be exposing yourself to Mpox.
Now, let's talk about prevention and control. What are the most effective ways to prevent Mpox transmission in households and also the community at large?
Okay, so the first thing we said was that the key mode of transmission is by contact. So if I have Mpox, and just like I have chickenpox in our home, when we have chickenpox, most of the time we separate the person. The person is isolated. The person's beddings are washed in warm water with Savlon. The person's utensils are cleaned well. You can't get Mpox from contaminated bedding, contaminated formite. So at home, if anybody has a rash, the first thing is that please go to the hospital. Let's confirm that this is Mpox or this is not Mpox. And then we can pick it up. So please, anybody with a rash, do not say, oh, I know this is measles. Just get to the hospital. Let us confirm that for you. And then we can put in the appropriate measures, which is mainly isolation and making sure that you don't come into contact with them. So at home, people can use gloves for people who have rashes. In the hospital, we will use the gloves. We will wear our mask if we are managing persons with Mpox. Washing of hands is the safest for all of us because you don't know who has touched anything.
Right.
So hand hygiene should be strengthened at times like this. As much as possible, if we can avoid handshaking, it will help us over the next few months whilst we try to bring this under control.
So we can almost go back to some of the practices that kept a lot of us safe during the COVID era. Enhanced hygiene, washing our hands, you say, wearing of gloves, also masks as well, and avoiding handshaking. We can go back to, the elbow touching or maybe the fist greeting that we used to do. Now, we've had some questions come through, Doc. Persons asking about vaccine. Is there a vaccine available for Mpox? And who should consider getting vaccinated?
So there's vaccines available for Mpox. We as a country in Ghana do not have it. And the vaccine supply is quite limited. So currently in Africa, I know in the DRC, there's active vaccination going on. In Sierra Leone, there's active vaccination going on. Liberia, Nigeria, and Cote d'Ivoire have the vaccines, but they haven't started the active vaccination yet. It also depends on the numbers and the outbreak levels at the moment. We are also looking at whether there's a possibility of acquiring some of the vaccines. We haven't reached that point yet, but we know there are vaccines available. So I'm sure that at the appropriate time, appropriate measures will be put in place. If you ask who should be vaccinated, in Sierra Leone, earlier on they focused on the healthcare workers. Because if you have an outbreak and you don't focus on the healthcare workers, there'll be nobody to look after the people. But then they are now focusing on sexual networks where they are vaccinating them also. So those are the key areas where vaccination is currently focused on.
Now, Doc, what treatments are available for people diagnosed with Mpox, and when does it become necessary for hospitalization, for example?
So what we say, let me start with the second part. We say that for Mpox as a country, if the lesions are mild and the person can self-isolate, so you isolate and the health system comes to you and will look after you in your home or in a place where you can isolate. If the person has mild or the person has moderate to severe disease, and this we will use the ages. So for a child with Mpox, that child will be admitted. For a pregnant one with Mpox, a pregnant woman will be admitted. For anybody living with HIV or diabetes or immunosuppressed and has Mpox, that person will also be admitted. Likewise, the elderly. I'm sure you're going to ask me, so do we have space to admit just in case you have an outbreak?
Yes.
Do we have space to admit all these places?
Yes, and then I'll ask after that as well, because you have drawn a distinction between those who might be hospitalized or get hospital admission and those who will be able to self-isolate. Do we have the beds? And also, what should the first thing anybody does, or what should the first thing or first action or steps that anybody should take in the event that they suspect that they have got Mpox?
First thing is you go to the hospital. Almost all our hospitals know their case definition. They can take the sample. The test will be done here in Ghana, and within a maximum of 48 hours, we will know. So once you go to the hospital and we suspect Mpox and we take the sample, we will keep you in hospital. Once the results come back, available beds to manage people. Key thing is first, if you have a rash, go to the hospital. Let us make that extension that this is chickenpox, this is Mpox, this is measles, and then we pick it up from there.
And how long does it typically take to recover from Mpox? What complications should people watch out for?
So remember we said that Mpox ends up with a rash, and these are more or less bigger rashes than chickenpox. And I'm sure you know that with chickenpox, sometimes when it heals, you may have scars on your body.
That's right.
So Mpox is a similar one. You may end up with scars on your body. If you have severe Mpox that affects, let's say, your eye, you may end up with blindness in the eye that maybe would have been affected. Also, if you have Mpox that is severe around your genital region, it may cause scarring and some problems with the genitalia. So these are some of the complications of Mpox. Yes.
And what about long-term effects or risks associated with the Mpox infection? For example, I know there have been talks of things like long COVID for those who have recovered from COVID or had COVID at some point. Does Mpox present those kinds of long-term issues for those who have been afflicted and subsequently recovered?
The long-term complications result mainly the scarring in the eye and on the body. In terms of, let's talk about long Mpox, that hasn't been documented as of now. But since it's medicine and we are still studying, I'm sure maybe in the next few we may come up with something. But for now, the knowledge out there, we do not have people presenting with long Mpox.
And what is being done to educate the public and reduce stigma around Mpox, especially in high-risk communities?
I'm happy you spoke about the stigma issue, and that has been one of the key things. That's why we believe that among the sexual networks, because of stigma related to it, people are not coming up. But in Acquired, we are engaging those networks to actively look for Mpox amongst them and then to help them. In that case, you're not going to publicize everything so that people do not go underground. As much as possible, key thing is that Mpox is not a deadly disease. Mpox can be managed. Let's encourage those with a rash to come so that we can help them. If we drive them underground, then that will be problematic for us.
And what about community members? How do we all support prevention, and how do we go about helping early detection efforts?
Okay, so the Health Promotion Department is developing infographics. We are developing some cartoons in different languages that we will enlist the help of the RTCEs to help us speak to the community. You know, in most of our communities, when anybody has a rash, there are community experts who say, oh, it is this rash, use this. But for now, since we do not know too much about Mpox, if you have a rash, let's encourage people to go to the hospital. Anybody has a rash, that person should cover that rash. And we will speak to our friends, traditional alternative medicine experts, to also help us refer these people so that we can help them.
And Doc, to refresh our minds, how many cases exactly then do we have in Ghana?
Currently, cumulatively, Ghana has 5 cases, but just 4 active cases now. The first case was somewhere in February.
And given where you sit, is that a cause for alarm, or is it something we just have to be vigilant and we'll be able to get through the other side?
I believe that we still need to remain vigilant. The whole of last year, we had a total of 5 cases whilst looking for them. This year, we've already had 5 cases. So I'm sure as we keep educating, as we keep looking, as people keep coming out to say, I have a rash, can you help me about it? We may diagnose more cases, but the key thing is that most of the cases are not linked. So we know we will weather the storm too.
Absolutely. Doc, thank you so much for your time this morning. Your final words.
Final words is, even though the numbers may go up a little, there's no need for us to go into panic mode.
No need to go into panic mode. Doc, thank you again for your time this morning and for giving us some much needed education on Mpox.
Thank you very much.
And that was Dr. Joseph Oliver Komi. He's the director, Ghana Infectious Diseases Center. Mpox case management lead, giving us some much needed education on what exactly Mpox disease is, how it is spread, and whether or not there is cause to be alarmed. And from where Doc sits, it's a case of enhanced vigilance. 19 minutes to the top of the hour. This is still the best breakfast show in all of the land. This is still 3 FM Sunrise on 3 FM 92.7.